snowball. You can see the images right here. Okay, this patient came because she had atrial fibrillation and she was symptomatic, and after some time of trying all sorts of medications and cardioversions, we decided to try ablation. And before ablation, we performed an echocardiogram, and this was the echocardiogram we had at that time. Now, what you can see here is obviously that there is something in the right ventricle here, right atrium here, right here at the lateral region, right here, and there's also something right here in the right ventricle, right? And then if we twist and turn, let me just go back here 1 second. I think it's easier to see here, maybe. I just have to find the right image loop. Here we go. I think this is the best. Okay, we repeated the study again. Here is what we see in the right atrium. There is a structure here. There seems to be a structure right here. And then if you twist and turn the transducer and you can work on this lateral region of the right atrium, you will note that there is actually a thrombus here. At least we think it's a thrombus. Again, another view, a right atrial thrombus. But this is not the only finding in this patient. We also found something here in the left atrium. Again, twisting back and forth, you can now see that there is also a thrombus here in the left atrium. All those who were with us in the last webinar probably remember this case. Well, what we did in this patient was we were thinking actually about operating the patient and taking the thrombus out. It would have been a fairly large operation, even considering that you'd have to open the left and the right atrium. Well, one might even just think about the left atrium, because the right atrium, if it thromboses, would go into the pulmonary artery, which would also not be such a nice thing to have a large pulmonary embolism. But the patient also has reduced left ventricular function, and we then decided, okay, let's just go for it and let's see how the patient was anticoagulated in the first place. When we looked at the patient, we found out that she did not have a coagulation disorder, but her warfarin was just simply not under optimal in the optimal therapeutic range. It was somewhere between maybe 1.6 and sometimes 1.8 to 1.9. So we thought that she was simply not anticoagulated sufficiently. So we gave her enoxaparin, 1 milligram per kilogram twice daily, so a therapeutic dose, and we monitored her anti-10A, which should be in the range you see right here. And with this, we repeated the study. Hope I can show you this here again. Unfortunately, it still does not work. But what we found was that the thrombus was slowly dissolving, and we only had remnants of the thrombus. Here you see that the thrombus on the right atrium is now much smaller, and the thrombus in the left atrium was very difficult to visualize. And when we repeated the TE study, which I cannot show you here, we confirmed that the thrombi were getting smaller. Now, I guess she was lucky that she did not have an embolus. In her case, my feeling was that the thrombus was not so mobile, and that it was probably partially already relatively good organized, so the risk of embolism at least was, I would say, moderate, and we took the risk, and it seems to work out fine, and so far the patient is doing okay. We'll just have to wait because the thrombus has not dissolved completely yet, but we'll check on her. We have her scheduled for a TE study in, I think, 3 or 4 days, and we'll see if anything has improved from the last exam. Okay, but showing you this case, I want to, okay, this is why I called it this, I called this case melting, because obviously the thrombus is melting. Okay, but the question I would like to ask you is, what is her underlying disease actually? Okay. You saw the images. You saw left ventricular function, the dimensions of the heart, and my question now is, do you think it is hypertensive heart disease? Do you think it's restrictive cardiomyopathy? Do you think it's heart failure with normal ejection fraction? Or do you think it's a dilated cardiomyopathy? Or do you think it's just something else? I'll give you a few minutes again. Yeah, you know, usually when we ask these questions, most of the people opt for the something else because, you know, you don't really want to give away the diagnosis in such multiple choice questions. So I can see that many people are already choosing something else. Okay, 63% of you have voted. I'll give you another second. Okay, let's close the poll. Okay, 36 of you say something else. 31 of you think it's restrictive cardiomyopathy. 12% think it's hypertensive heart disease. And 9% of you think it's heart failure with normal ejection fraction. And 12% think it's dilated cardiomyopathy. You know, to tell you the truth, I do not have the right answer for you as well. But here are a few thoughts and a few additional bits of information. She does have hypertensive heart disease, but she was never really very hypertensive. Her left ventricular myocardium is thickened. She has hypertrophy, but that was not, you know, extremely. What really strikes us, if we go back to these image loops, I think I'll just go back to the loops I showed you previously. Look at this here. She has very large atria, and very large atria usually fits together very nicely with restrictive cardiomyopathy. So thinking of restrictive cardiomyopathy, we put her through all sorts of tests. We performed myocardial biopsy. We took a look at you know, her blood samples to exclude sarcoidosis or some form of iron disorder, hemochromatosis. And looking at the biopsy, we did not find amyloidosis either. So we did not really find a cause for her restrictive cardiomyopathy. Could it be that she has some unknown form that we're not aware of? Maybe it is a combination. Maybe it is some form of heart failure with a normal ejection fraction. We are still somewhere in the dark, but my intense feeling is that, you know, I still think that it must be some form of restrictive cardiomyopathy or some form of infiltrative heart disease. By the way, we also excluded sarcoid heart disease. So I guess this is still open, and you know, in the long run, I'm just afraid that this patient, who is not very old yet, will end up with heart transplantation. Okay,